Hello, everybody, and welcome back to the Strong and Simple podcast. This is one of your co-hosts, Marissa, and I'm here with Michelle. Say hi, Michelle.
Oh, hello, everybody.
And we are joined by a very special guest this time around, Rhonda Chamberlain. Welcome, Rhonda.
Thank you.
You're welcome. So to give our listeners just a little bit of information about Rhonda, she is a mom to 3 girls, a physiotherapist, and lover of all things fitness and wellness. Rhonda has been practicing as a physiotherapist since 2010 in an exercise-based setting. She started her own virtual physical therapy and fitness coaching business in May 2020 and is excited to continue to watch it grow. Her passion for exercise began at 3 when she started competitive gymnastics, a sport that she competed in for over 12 years. That's very impressive. And she now finds her passion in strength training and inspiring women to realize how strong they really are. Yes. After having a more challenging recovery with her second daughter, she found a passion for all things pregnancy and postpartum. She attained her pregnancy and postpartum athleticism coach certificate in March 2020, and she has since completed several other women's health courses to continue her expertise in this area. With all of that training and all of that experience, her mission is to help busy moms return to exercise feeling supported and encouraged, and to help them ditch the all or nothing mindset to see that it is possible to fit exercise into their busy mom life. I love all of that. That sounds amazing. Yep. Welcome, Rhonda.
Thank you. Thanks so much for having me.
Yes, absolutely. I'm so excited to hear more about all of your amazing experience and your insights. And I'm a nerd, so I'm here to learn from you too. And I'm sure Michelle is here for that too.
Yeah.
So could you tell us a little bit about, we heard just a little bit about how you kind of got into things, but can you tell us a little bit more about, what you're up to right now, where your passions lie, and kind of how you really got to sitting down with us here tonight?
Yeah. So I, like my bio said, so I've been a physiotherapist since 2010, and since 2012, I've been an exercise-based therapist. So I worked for almost 10 years in a CrossFit gym. So I was a physiotherapist that focused on getting people out of pain, number one, of course, but then also helping people get strong and ideally prevent future injuries. So that was my love for over 10 years. I was a very happy employee for that length of time. And I had 2 kids. So my first pregnancy, I've chatted with Michelle about my story before that. My first pregnancy almost served to reinforce my bias that because I was fit and strong, I was able, I hate the term bounce back now, but I was able to get back to exercise, bounce back relatively quickly. And so, yeah, it kind of reinforced my bias that it's because I was prepared. It's because I did all these things. And that's kind of what society sells to us, right? Is that if you do A, B, and C, then you're going to have a magical, easy delivery, and you're going to have a magical, easy recovery, and your body's going to look like you never had a baby. And so that did sort of happen to me after my first child, my first daughter, and then went on to get pregnant pretty close together. My 2 girls are 22 months apart. And my second daughter, the pregnancy again was pretty seamless. I was very fortunate to have 2 relatively easy pregnancies. And then after Tegan, tried to basically get back into CrossFit the same way I did after Sadie. So about like 10 weeks postpartum, got back to the gym. Knew enough to like modify my workout. So I was doing, again, CrossFit style workouts, but modifying them. But now knowing what I know, I went way too hard, way too fast. And my body just wasn't ready. And so, yeah, so I dealt with prolapse symptoms. So for those of you that don't know, prolapse is a lowering of our pelvic organs into our vaginal opening. That is a very normal, common occurrence, especially after having kids. But even as a physiotherapist, I knew what prolapse was, but I sort of chalked it up to I had prolapse symptoms during pregnancy, and I sort of thought, once I have this baby, that will just go away. Everything will be fine. But yeah, anytime I tried to do a workout, I just had a heaviness feeling, almost like a tampon was falling out. Just very uncomfortable, very odd feeling. And I also had really bad abdominal cramping when I tried to work out. So needless to say, I panicked. And again, even knowing what I know, I felt so lost. I felt so confused. I felt so lied to because again, society tells us like, if you're fit and you're strong, you'll have no, problem getting back to fitness. And so honestly, I stopped all exercise for probably 2 weeks. I just did nothing. Didn't know where to start from there. And it's interesting because I've been in this fitness world for 10 years, helped people rehab from so many different injuries, but I never looked at pregnancy as an injury. Because again, I think there's that like ego component of like, I'm pregnant, I'm not injured, right?
Yeah.
That. I talk about athlete brain a lot. I have athlete brain where, I felt like I had something to prove to myself and to people that I was able to continue exercising during pregnancy and postpartum. And so honestly, my identity just got knocked off its head in that moment of like, if I can't work out and I'm trying to, get back into a life pre-kids that looks somewhat normal, like, what do I do now? So so I basically started, I always say like, I almost went back to school in that moment. I started learning so much on Instagram. I started following Brianna Battles, which is the course I ended up taking, pregnancy and postpartum athleticism. Jessie Mundell is a big name in this world. Started following her. She has a podcast, To Birth and Beyond. Started listening to that and just started really diving into the world of pelvic health. And it was just such a huge light bulb moment to me of, oh my goodness, why have I not been taught this information? And this is why I'm not recovering, is because I haven't rehabbed my pelvic floor. I haven't rehabbed my body. I just expected my body to get right back to where I left off. And that we just can't expect that of our bodies, especially after like multiple pregnancies and births. And so, so basically I started learning more, basically went back to square one. And it reminds me of how I would work with a client that has like a back injury. I basically started from the basics, like started with breathing. So all of a sudden realized like, oh, I have to work on my breathing and my breath connects to my pelvic floor. Like, what? This is brand new information. I was so like mind blown. I worked on that, worked on just very foundational rehab, physio style exercises to build my body's capacity again, just nice and slow and steady. And by 6 months, I was getting back to like sort of normal workouts again, but it took time. And I was again, mind blown that this was not common knowledge for myself as a physiotherapist, let alone the public, right?
Yeah.
And so at that point, I just clued into the fact that if I'm feeling this way, for sure, there's other folks who, are excited to get back to exercise after having a baby, dealing with symptoms or even not dealing with symptoms, but feeling so lost and confused about where to even start with their exercise journey. So, so on my mat leave with my second daughter, I basically started what is now my business. Didn't think it was going to be a business at the time. It was kind of just like a fun passion project. Started working with a few friends that had just had babies for free to start, just because I was so in love with what I was doing, just to see if I could help them the same way I helped myself. Sure enough, they loved it. They did so well. So when I went back to work after my second daughter, I started as a little side hustle in this pre-postnatal world. And since then, so that was, I think it was May of 2020 that I officially started my business. And as of January 2022, this year, I'm full-time online business owner. So that's been the journey. So lots of ups and downs and twists and turns along the way, as anyone that owns a business knows. But honestly, I can't picture myself doing anything else now. Like I'm just so passionate about it. It's so much fun. I love the online fitness space. The online just business world in general is just so fun for me. So I'll just see where it takes me.
That's so awesome. First, congratulations on going full time. That's so awesome. I think you really like hit the nail on the head. Like there's so much about pregnancy and the postpartum journey that is not talked about. And so we hear these like little bits and pieces and like snippets of these like, not necessarily positive experiences that other folks with uteruses have gone through. And, it creates so much more fear for folks. Like, wait, there's no way to prevent prolapse. Wait, can you recover from prolapse? Like, am I going to have that? Like, and, you know, it kind of, for some people, it's like, well, no, I don't want to have kids. Childbirth is terrifying. Your organs can fall out, you know? So I think it's so important to do what you do and start talking about these things and dispelling all of those myths, and kind of like reassuring folks that it's like, you can rehab things, like it's not the end of the world, etc.
Yes, for sure. And I think that's my biggest message, is sort of finding that middle ground, right? So yeah, there's a lot of fear mongering surrounding a lot of pregnancy, postpartum things that we deal with. So prolapse is a big one, diastasis is a big one, incontinence, leaking is a big one, where it's like, don't do anything postpartum, or don't do anything during pregnancy, or it's going to cause this, this, and this. Yeah. Or again, it's the opposite extreme that I sort of veered towards, which was, you're a badass during pregnancy, like keep doing all the things, like you'll be fine. And, you know, like, don't worry, don't listen to your body, like it's fine. And yeah, again, during pregnancy, I did a decent job of listening to my body, but also did not know what to listen for. That's the thing too.
Yeah.
And as an athlete, you're taught to ignore when your body's giving you symptoms, right? And again, I was lucky during pregnancy, I didn't have any glaring symptoms. So, but again, knowing what I know now, I could have done a better job of like finding that middle ground. So that's what I really hope to help my clients do is, yeah, during pregnancy and postpartum. I do think, you know, especially if you come from a background that you enjoy fitness and you enjoy sports, we do like to still be challenged, right? So, you know, some programs might be boring to people because it's just too watered down, right? Whereas again, some programs are just like, get back to it. So I try my best to find that middle ground for people, and it's very dependent on the individual as well, right? And so I think that, you know, as now 12 years in like a fitness world with a physio background, I think that's one of my strengths, is like meeting the person in front of me where they're at and trying to get a feel for like, does this person need a little bit more? Does this person need a little bit less? Like trying to find that middle ground for that person in front of me.
Yeah, I think there's this, I mean, first of all, the fact that you're not the first physio I've spoken to who didn't realize all of the stuff about, like, you know, about the pelvic floor and, you know, about prolapse, whatever. You learn a little bit about it in school, but the amount of time that is done talking about and learning about the pelvic floor, especially women's pelvic floors, is minimal in the training. And I think there's also this big shift, mostly from the online space, like Instagram and stuff, where now some of the things you just mentioned, diastasis and prolapse, and now those have become big buzzwords for folks who claim to be able to cure these or help you prevent them, or that fabulous phrase that we hear so much, bounce back from quickly. Yeah. And they're not necessarily qualified folks to be doing that work.
Yes.
So maybe if you want to speak just a little bit about maybe how anybody who's listening today can identify a support person or a program that might actually be beneficial to them in the long run. You get what I'm saying?
Yeah, I was going to help. I was like, reputable.
Yes. Great question. And it is so challenging, right? And we're in the information age where, again, information is so accessible online, right? And I think that's a wonderful thing. But I think, yeah, we do, even as us as individuals consuming information, like we do have to be mindful of where that information is coming from, who it's coming from, what their motivation might be, right? So I would just say, like, if you are somebody trying to get back into fitness after having a baby, personally, I would say make sure that person has like training with the pelvic floor. Because as we know, you know, folks with uteruses get targeted a lot with ads because we tend to be sort of vulnerable, because we haven't been, you know, brought up to talk about these issues openly. So I think, again, because there's so much fear around it and there's so much taboo surrounding these issues, it can be a scary world to live in where, yeah, you're dealing with prolapse. You're like, my organs are falling out of my body. What am I supposed to do? So then we might be tempted to go for something that's very extreme and like focuses on that fear mongering messaging of like, we can fix your prolapse in just 6 weeks. You just do these 6 exercises and your prolapse will be reversed. And like that, those messages is what I would be very weary of, because that's just not true. Same thing. This is huge in like the diastasis world where, yeah, it'll be this program and it'll be a gajillion dollars and it'll say, yeah, again, do these 6 exercises and your diastasis will be healed. You'll have no gap. Get rid of your mommy tummy. Get rid of your mommy pooch. All these gross messages. And again, it's just not true. Physiologically, some women just end up having a gap in their tummy that doesn't go away. And programs that promise these things, we just have to be very wary of that. And so again, I'd say, and find a program that has a human being behind it, instead of, again, some of these cookie cutter programs that are just, you know, cycling women through. And I say that with, you know, I follow people like Rhonda Battles. She has programs now that a lot of women go through, but she, again, she's done the work, she's done the research, she has, you know, background in pelvic health, she has professionals supporting this program. So that's different, right? So when people grow to these levels, but they've done the work to get there is one thing. But if it's someone, you see it often where a fitness influencer makes it big as a fitness influencer, has a baby, bounces back, has a super easy time, and then sells to pregnant postpartum folks, right? And like, if you can do it, I can do it. And that is just very dangerous. Because again, it's just not true. It's just not true.
Yeah, I think we see that with the fitness influencers in general anyways, right? Like, well, if you do what I do, then you are going to look just like me. So yeah, that idea of, you know, I did this during my pregnancy and after my pregnancy, and now look how fast I quote unquote bounced back. And you do these things and you're going to have the exact same results. And I think you nailed it on the head there with the, you know, the targeting of people who are in a very vulnerable space. You have all these hormones raging. You're trying to take care of a human, a little human, trying to take care of yourself, probably also trying to take care of the house, trying to think about going back to work. And then you're having all of these ads and messaging that are now targeted at you because of all the algorithms that are like, well, you should be at 6 weeks. Why aren't you back to normal, quote unquote, right? And it's so harmful. It's so harmful.
It really is. Yeah.
Where did that magic 6 week number come from anyways?
That's a great question. And it's honestly something that I've been thinking about more lately. I actually have a client right now who is post-surgical for a prolapse repair. So she had quite a significant prolapse that needed surgical repair. And her surgeon basically cleared her to go back to work at 8 weeks. And this is like a pretty major surgery. And she's someone that dealt with quite debilitating symptoms for many years, has a very demanding job as a nurse, like a lot of things going on. And so, yeah, so it's just interesting. So I think what happens, and this is in talking with other colleagues in the pelvic health world, I think that 6 week or 8 week checkup, whenever you end up going, this is true for a C-section too. From a medical or surgical standpoint, surgically, you're cleared in the sense that the likelihood of something happening to either like your sutures or like the tissues, if you've had a vaginal delivery, the likelihood of something terrible happening is minimal. And that's from just like a very medical, medical, physical standpoint, right? So, so same thing with this surgical person. The surgeon, yes, might say you're clear to go back to work because from his perspective as a surgeon, the chances of something happening surgically, medically is minimal.
Mm.
But as a physiotherapist and as people that then see these clients 6 to 8 weeks after having a baby or after having surgery, we know that is just the very beginning of their healing journey, right? Because so I view my clients from a very like biopsychosocial lens, where the bio, of course, is one piece, but the psychosocial is a whole nother ballgame, right? So like you just said, Michelle, like there's so many factors that go into the healing journey for someone that has a baby, right? It's not just the physical healing. That is just a minor component. Like that, it is a huge component, but in the grand scheme of things, there's so many other things to consider, right? So I always say to clients like that 6 to 8 week checkup. And again, I was guilty of this. I took that 6 week checkup as green light. I'm good to go. Right back to CrossFit. Again, modifying slightly, but not much, because I was under the impression that my body was ready. But again, factoring in everything else, like I was dealing with, I had now had 2 kids. I, now looking back, was realizing how much of my identity was tied to my fitness. So I had so much up here in my head to work through, not just physical healing. Yes, my body wasn't physically healed, but I do think a lot of it too was just, I was just overwhelming my system when I wasn't ready, right? So,
yeah.
And for me, you know, I didn't obviously enjoy going through that challenging recovery, but it was truly a blessing in disguise because it forced me to deal with some of these mental blocks that I had head on. And again, just sort of like realizing that I needed to change my mindset about exercise. I needed to change my mindset about my body. I needed to change my mindset about food. Like so many healing journeys started because of that tough recovery. So in a way, I'm thankful. And though these are the conversations that I have with clients that sometimes are more important than like the fitness. Like I know probably you guys talk about this too, that like, yes, I'm a fitness instructor and that is what I sell, but that is, you know, the bare minimum of what I work on with my clients, right? Like that's kind of like the entry point to get people into the program.
Yep.
But it's everything else. It's like they don't realize what they need. They think they want a fitness program, but what they need is everything else, right?
Yeah, absolutely. I feel like what you just said just all the more underscores the dangerousness of those one size fits all 6 week quote unquote programs. I feel like they're not even legitimate enough to call them programs. I'm going to put it in quotes from now on, finger quotes from now on. But yeah, you know, just this, I mean, when you're thinking about something as, you know, I consider something like diastasis to be a pretty significant thing, you know, like a physical condition, like just like with prolapse. So to be trying to convince somebody that doing something for just 6 weeks can remedy that, well, how intense must that program be? Like how not ready may those people actually be that are enrolling in it. And I loved what you were saying about starting to unpack the mental and emotional component of it, the mindset component of it. I'd love to dig a little bit more into that as well. I think there's, you know, we still have a lot of work to do on the physical aspect, right? And this bounce back notion when it comes to, you know, bodies postpartum, but so much of that is intertwined with the mental, emotional. And I think there needs to be a lot more attention brought to that.
Definitely. Yeah. And so bringing it back to that second recovery after my second daughter. So when I stopped working out for those 2 weeks, again, I had sort of like a bit of an identity crisis in the sense of like, who am I if I'm not Rhonda the CrossFitter? Because I was so excited to get back to exercise. So I have always talked about, and a lot of people talk about, how exercise is so good for their mental health. And that was 100% me. And I know after my first daughter, I dealt with a little bit of postpartum anxiety where I had a really hard time leaving the house. I struggled with breastfeeding. So there was a lot of struggles I had in my first pregnancy and delivery in the sense of, again, just losing that identity. So I wanted to do things differently the second time. And so I knew to get back to exercise was going to just feel really good for me. So I was so excited about that. And so again, when my body just wasn't ready, my mind was ready, my body wasn't ready. It was like an awakening moment for me. And so I remember sort of I talk about this now with clients, having a moment where I had to parent myself. And so we always have these two sides of like the athlete side of Rhonda was like, hey, like whatever, push through, you're fine, suck it up. But then like the parenting gentle side of me, the same way we would talk to a friend or a kid, is like, Rhonda, you are only 10 weeks postpartum. You're still healing. Part of healing is resting. It's okay to rest. If anything, it's more therapeutic to rest than to exercise right now. Like lying on the couch, you're not lazy, you're healing. And so I had like these two like battling voices. And so basically I parented myself, told myself I say in quotes, you're only allowed to work out 3 days a week. On the other days, you're resting. And that was so hard for me because I was someone that prided themselves on working out 5-6 days a week. That's when I felt my best for years. And I had the privilege of working at a CrossFit gym. So that was so accessible to me. And so, so in those moments lying on the couch resting, I felt so much guilt for probably weeks. For weeks, I felt that guilt. Slowly, that guilt started to go away. And I started to just start to question the stories I was telling myself about exercise and about what counted as exercise. Because I would, as I was getting back to exercise, again, I was doing physio type movements. So I remember I labeled them movement therapy sessions because it didn't seem like a workout to me, right? And again, my athlete brain, it didn't count. I wasn't sweating. I wasn't breathing hard. My muscles weren't burning, like all the things that I would classify as a good workout in the past. My movement sessions had none of those things. But so I started to just, again, talk to myself about that and say, like, this is part of your healing journey. You are meeting your body where it's at today. Today, this is what your body needs. And 100% this counts as a workout. And I would just like celebrate those small wins. And then, over time, I was able to start doing more because I took it slow. And I think that is so hard for athletes. And I talk about this all the time with my clients. The slow road to recovery is actually faster in the end because we don't have these massive setbacks, right? Yeah. So many people will dive right back in, deal with a setback, they stop, they dive back in because they have to make up for lost time. They have a setback, so they have these huge dips and dives. So their capacity, their tissue tolerance ends up being pretty minimal. Versus if we do slow, steady progressions, the road to recovery is still never linear. There's still going to be ups and downs. But overall, that capacity is going to build much faster if you're taking it slow. And so that was huge for me. That was such a light bulb moment that I had to basically rehab my body postpartum the same way I would rehab a back pain client. And that was a light bulb moment because that is not what's sold to us in society. In society, it's like, women have done this for years. Like, suck it up. This is easy, right? Like, why are you complaining? Why are you talking about your vagina? Like, stop doing that, right? Like, these things. And it's like, such BS because these are real things that are happening to people all the time. And we need to just have these conversations to normalize it and realize it's an effing hard journey. Like, it's so hard to recover postpartum. And even if you have a quote unquote easy pregnancy delivery, it's all the other things in that realm that make it so hard. And so, I just want to be a coach for people that validates that, right? And acknowledges like, you just went through something so hard. Yes, you are strong. Yes, you are resilient. Your body will, get back to all the amazing things you want it to do. But like, have the kind of respect for your body to take it slow and understand that it is a challenging event and we need to just move slowly.
Yeah. And I think that can be related to a lot of injuries too, right? Like, especially folks who have a particular mindset about what exercise is, what fitness is, what movement is, what counts, that has been drilled into our heads about like, if you want it to count, it should look like this. You should be sweating hard. You should be sore the next day. All of these kind of myths about what's good movement, right? And for anybody who enjoys working out hard like that, it can be really hard to be like, oh, my body, it's almost like your body betrayed you in a way.
Yep.
Right.
Yeah. And athletes like really struggle with that. Right. So yeah, like I dealt with many injuries throughout my time, and I think it's tough too when you're a young athlete. So I was an athlete from age 3 on, and I probably did bounce back really quick from injuries because you're young and things happen fast.
Yep.
But yeah, as we get older, this is just a fact. This is not like a fear thing. As we get older, things just take longer, right? And multiple pregnancies, deliveries take its toll on your body. That's just a fact, right? And so honoring that is a big part of it. And yeah, the other thing I wanted to sort of touch on with that whole conversation is the body image side of it. So yeah, like growing up as a gymnast, it's only in therapy that I've started in the last several years that I realized how like deeply that experience impacted me. And yeah, so in those early moments, you know, if I'm honest with myself, there was a fear of losing my body, like gaining weight and losing my small body size. For sure, there was that tied in. As much as I would wish to say that wasn't true, that for sure was part of it. And so, yeah, so again, because exercise has always been sold to me and to us as a means to shrink our bodies, it didn't seem like it was going to be worth it, quote unquote, to do these rehab type workouts because it wasn't going to make my body smaller. And especially in the postpartum phase, like I was very motivated. And this is where it's frustrating, is because I've been in the fitness world and the health world for so long, so many of these, you know, programs and ways of eating are sold to us as a way to stay healthy, quote unquote. And so I didn't realize how disordered a lot of my thinking was around food and exercise until I started to learn more about diet culture, more about just the systems that create these thin ideals. Once I started to learn more about that, all of a sudden, again, it was light bulb moment after light bulb moment of, yes, this is why I'm struggling, because I only see exercise as a certain way, right? So there was like, again, a lot of fear there. And so that, again, is a huge part of what I talk to my clients about. Yeah, it goes so many layers deep, right? And it depends on where someone's at in their journey. And again, I meet them where they're at. But if clients come to me with weight loss goals, you know, obviously I always validate that. And I say, you know, I understand why that is and why that's a goal. But let's also start to dig deeper as to why that's so important to you. And what is it about getting smaller that you think is going to change your life? You know, is it you want to feel happier, you want to be attractive, you want to have energy? And can we focus on some of those things without having weight loss be the number one goal? And it's such a tricky, I'm sure both of you sort of have these conversations too.
Yep.
For sure.
Yes. And I collaborate closely with mental health therapists in this regard too. And I have some non-diet dietitians that I refer to all the time. Cause that's at the end of the day too, that's part of how I approach my clients is like, I can't do it all. I'm not everything to my clients. There has to be collaboration. But yeah, there's just so many layers to this conversation, right? That it's
I know.
However deep you want to go, like I'll go deep with my clients if they want to.
I think it's really great that you do that with them and that you take that approach of being able to validate their concerns and then also try to work with them to like scaffold that reframe so that it's not, because we all, like for me, when folks come to me with weight loss goals, it's, you know, whether it's a nutrition client or a fitness client, it's, you know, I don't ever want people to feel shame or bad about wanting a weight loss goal or wanting to lose weight, because first of all, most people don't even know that there's another purpose behind nutrition and fitness, right?
Yeah.
Like that is like, why else would I do any of these things if it wasn't to lose weight? And especially for folks who that's all you've ever done your whole life is try to lose weight, try to get smaller. It may not even actually, it might be what you want and it might be what you think you want, but it also might just be you don't know what else to ask for. You just know that you feel tired or you feel sluggish, or, you know, your digestive system isn't working as great as it used to. And, you know, those might be the things that then are impacting how you're feeling about your body. And everyone else is selling weight loss. So that must be what's going to be the, you know, the magic cure here. So it's tricky. It's hard because we're working with humans and there's so much in our brains that we have learned and internalized, and to try to pull all those pieces out it's emotional.
It is a lot. And yeah, so I will even admit, and I've, you know, said this on podcasts before too, that I have, and I'm still working through that bias as a healthcare practitioner, that size does not equate with health. Right. And so again, even coming from a gymnastics background, we were taught, like, if you're smaller, you're going to be a better gymnast because you're lighter and you can jump higher. So from, you know, I'm sure those messages were thrown at me at like age 5, right? So yeah. So no wonder I have these deeply ingrained biases about size and health. And so, yeah, so again, I'll admit, I know a lot of fitness trainers talk about this too, that I used to weigh and measure my clients. I did. And now I will never do that again. Because we just, you know, you don't know what you don't know. And I thought I was doing that to better their health. But now looking back, it's like, I could have done other things to help. And I was doing other things to help them, you know, with their overall health journey, but that was not necessary. Right. And so I think helping unpack that in my clients too is very challenging, right? Because again, a lot of people go to their medical doctor and are told, you know, I have this going on, I have this going on. And the first and only thing that they're told is you need to lose weight. And that's just so hard. So how do you not then believe that that's true? Right. And again, like, there are for sure situations where fat loss might be beneficial for people for their overall health. But again, I don't think that has to be the number one focus, right? Like, there's so many other factors of, you know, improving how we move our body, improving how we eat, that maybe as a byproduct, weight loss happens, but maybe not. And that person will still be healthier, right? Even if their body size stays the same.
Yeah, it's like weight loss is not a behavior, right? And our bodies, we could be doing all of the things that we think we're supposed to be doing to get to that outcome. And our bodies might be like, no, I'm just going to hang out here at this number or at this pant size or whatever. Like, this is what feels good right now. But all those other things you're doing, those are the behaviors, those are the habits. That's the secret sauce, right? Like, to feeling better and feeling healthier and overall wellness, right? But it's not as sexy to talk about those things, right?
It's not. No, I just did a really great podcast with Jornetta Edelstein, and she talks a lot about this with food, right? And that's what I find interesting, being an online business owner in a world where I think it is changing, but in a world where, fat loss programs, 6-week challenges, all these quick fix programs exist. You know, my message is, come join my program. You're going to be here for 1 to 2 years and you may or may not lose weight and you'll get stronger, but you might still have setback. It's like, it's not, you're right. It's not sexy to say it that way. Right.
Yeah.
It's not,
yeah.
I'm not in the business of quick fixes. That's just not my thing.
Yeah. I feel like,
which is great.
Yeah. Yeah. I think that resonates with both of us. It's not the easy sell.
It's not. It's not. No.
Yeah.
Yeah. I wanted to touch on too, just with the fitness side of things too, with the mental health piece, because that's something I talk about a lot with my clients too, that, I wanted to get back to fitness to help with my mental health. But I think what I quickly realized too is that I couldn't rely on fitness for my mental health for that to be my only outlet. And so that was a part of my journey too, is how else can I work on my mental health? So part of that for me was, going to therapy, like meditation helps me a lot, journaling, just having quiet time to myself as a mom is a big deal for me. So finding other outlets, because we can't always assume that exercise will be something that's there for us. And we can't always assume that we can work out intensely to help with our mental health. So having other outlets for our mental health, that's a big thing I talk about with my clients too.
I think that's such an important point. And we hear so many people say like, well, the gym is my therapy. The gym is my therapy. And it's like, no, the gym can absolutely give you a boost. It can absolutely be helpful, but it can't take the place of, seeing an actual therapist or getting a diagnosis or, maybe taking medication if you need to.
Yes.
Working through trauma. I love that you touched on that. I think that's so important. Yeah.
I mean, it really takes a village of people. And I think that, when you work with a PT or a personal trainer or a nutrition coach, and they are able to recognize, let me refer you, like for me, like if I have a pre and postnatal sort of like personal training certification, right? But I am not a physical therapist. I'm not a pelvic floor physical therapist. So if there is something that somebody needs more support with, I'm going to refer them out and encourage them to go seek that support, because that's outside my scope. Right. Yeah. And I think it's really important to find service providers and coaches who can kind of check their ego at the door and say, I recommend you see somebody who has more qualifications or more specialization in this area to support you, because otherwise it could be causing more harm than actually helping, So
definitely. Yeah.
That referral network's really important.
For sure. Yeah. I'd say that's another, just getting back to that question you asked about, programs, that's probably a red flag too. If, you meet with someone and they say, I can fix everything, or I can fix you. Yeah. That's a red flag.
100%.
Yeah.
Yeah.
Now, why do you think that diastasis blew up the way that it has recently? Because I'm going to be honest, until 2019, and I've never been pregnant. I don't have children, but I know lots of people who have and who do. And I had never heard of diastasis until 3 or 4 years ago. And now it's every pre and postpartum person out there is like, diastasis, let me heal your diet. Why do you think it had this come upping?
Yeah, I don't know. That's a good question. So even Brianna Battle, she talks about this, and that's the course that I took. And she herself dealt with a very significant diastasis. She talks about this on her podcast too. She ended up having surgery to repair it. And when she was getting back into exercise, she also came from a strength and conditioning background. Basically got back to fitness, but had this massive gap in her belly that no matter what she did, it still was there. And so even again, with her knowledge in fitness and strength training, did everything that she knew to do, and nothing changed in her belly. And so she herself then was on a mission to seek out anybody and everybody that's talking about diastasis. So Lisa Marie Ryan is another big name who dealt with a very significant diastasis. Anthony Lowe is someone in our pre-postnatal world that talks a lot about it. So I think part of that too, I think, is just the way fitness has gone for women. I think I always joke that like our moms were not doing CrossFit and running marathons, right? Like our grandmas, there, right? So yeah, as people get more active and more into these fitness realms, there is just a need for this information, right? Whereas maybe before, yeah, people might have noticed. So like that mummy tummy or that like mummy pooch, I think that those terms have been around for a long time. So I think probably in the past it was more related, and it's still related to aesthetics, but maybe in the past was more related to aesthetics.
Yeah.
That I have this bulgy thing in my belly that won't go away. Whereas again, as people got more active, then it started to get tied to athletics too, right? It's like, I have this bulgy thing that I don't like the look of. And also, is it okay? Am I safe to do A, B, and C if I have this bulgy thing, right?
Yeah.
So I think like coning and doming became a big thing, right? Because it's like, which is basically you have a gap in your belly, you're doing something like a sit up, you're doing something like a pull up, and you have like a big dome that forms in that gap. So people were panicking about that. Like, what is that? And am I damaging my body? So yeah, so I think as the information was more needed, then more people started to talk about it. And then as anything goes, if something becomes a moneymaker, then everyone's in on it, right? Because it's like, and I think the money-making side of things and sort of like the extreme messaging side of things, again, attacks the insecurities of women, right? Attacks the aesthetic component of it. Again, get rid of your mummy tummy, get rid of your pooch with this, this, and this, right? Whereas I think, I'm so thankful I was able to follow people like Brianna, Lisa Marie Ryan, and Anthony Lowe, because their approach is more about that functionality piece, no fear mongering, right? Like your body is still strong and resilient, even if a gap is there, right? You're not broken. You don't need fixing. Yes, you might, have to do things differently to rehab those muscles, but you're not broken. You don't need to buy some expensive program to fix your belly, right? So it's, again, finding those middle ground messaging where it's not these extreme pendulum swings is the trick. So I think it's as people got more active, as people started to recognize they didn't like the look of their belly, as they started to wonder whether it was dangerous to do things with their belly. And then as people started to realize it was a money-making thing, I think that's where diastasis became a big deal.
Yeah, I agree. I think it's like, it almost feels like backlashy to me, and in some sense, because, we had, I can remember, I think the first time I heard about it, it was like maybe 8 years ago or 6 years ago, something like that. And it was a prominent marathoner who had diastasis. And, it's as these really strong women athletes were coming forward and saying, look, I'm strong and I have this mummy tummy or whatever because I have diastasis. And it was kind of like embracing that, like, this is what my body looks like. This is what it's like postpartum. I get this like feeling that seeing people kind of seize on that and start talking about it, the diet industry was like, oh, here's the money-making opportunity and another opportunity to continue controlling women's bodies. Let's push this aesthetic and, go from there. And it's, I just got an icky feeling from like how it blew up like that.
For sure. Yeah. There's someone I really appreciate online, Anemisette Graham. She is a super strong human being, and she has still a significant diastasis and a hernia. And that's her messaging online is, she can do so many things with her body and she still has a significant gap. And she talks openly about this, that in the past, pelvic floor physios have reached out to her and said, you should be careful. Like you're people are going to watch you and try the things that you're doing. Like, be careful. Like, that's dangerous. And again, it's extreme, right? It's like these fear-mongering messaging.
Yeah.
Whereas, maybe for someone that it could be dangerous, but this is her body and her body is doing just fine. And in fact, she's doing amazing things with the diastasis, right? So anytime we see these extreme messaging, that's where we need to be wary of, is this actually helpful? Usually it's not. Usually it's more harmful than good.
Yeah.
Agreed.
Mm-hmm.
Totally.
Agreed.
Mm-hmm.
So how can folks work with you and find you and learn more from you? Because I think that your messaging is so needed in the world. So I want everybody to find you and, reach out to you for support if they are feeling like things today are resonating with them.
Yeah, thank you. So my Instagram, that's usually the place that I hang out most. So at Rhonda Chamberlain PT is my handle. My website is the same. So www.rhondachamberlainpt.com. I also have a podcast with my friend Dana. She's a pelvic floor physiotherapist as well. So Pelvic Health and Fitness Podcast. So we talk about all these things and more on our podcast as well. And so I work with clients fully virtually. So I do one-on-one virtual physiotherapy. So in those sessions, I'm helping clients rehab any injuries that they might be dealing with, and also helping them slowly ease back into exercise in those virtual sessions. And then I also have an online fitness membership called Strong at Home. And that is basically a do on your own time program that is essentially what I do with my one-on-one clients, but they do it in the comfort of their own homes at their own time, 10 p.m. at night if they have to. And that's in True Coach. And so basically I'm in there with them, cheering them on, giving them modifications if they need. So those are the two streams that people can work with me.
Awesome. Yay. Love it. So we'll link all that info in the show notes. So everybody, if you're interested, be sure to check Rhonda out at all the places she just mentioned. And it's been such a pleasure to have this conversation with you, digging deep into some really important topics tonight.
Thank you. Yeah, I, as you can tell, super passionate about this. I could talk about this stuff all night. So thank you.
Yes.
Thank you.